Breathing through your nose is the most important function of your entire health. Proper breathing through the nose and to the diaphragm is the most important function that determines your health. Here in this video, I'm with a patient analyzing the entirety of the features of face and coordination of eyes, mouth, ears, neck onto the 2 feet support as this patient is standing up. The way I evaluate the airway is not in the position where we sleep, but rather the way we organize ourselves against gravity. Because the way we're gathering information with our eyes, mouth, ear, neck, posture of all of our system together on support of 2 feet determine the way we breathe, and from there, the way we breathe at night. As a dentist and airway specialist, one of the things I look at more than anything is how the features of the face tell me the organization of the body and nervous system for posture of breathing. I hope this video is useful to you, and if it is, please share it with someone. And let your hands be great. Ideally, I would shake the Achilles because they get tight from there, but that's a part of compensation. So now go ahead and open your eyes and look straight ahead. Vestibular system is down on this side and it's external. Eyes down here, mouth is down. So I know he's grounded over here. He referenced the ground with that vestibular system better. So as he wants to move through space, as he moves his head, eyes and mouth and ears have to agree with the foot. If not, then he gets limited in motion in one side. So cerebellum would lock his motions. Now his posture is here. Again, was it a descending or ascending? We're about to find out. Or how do we address it? Which was a perfect question you ask. Smile as big as you can. I want to see teeth. There you go. Mouth is down here too. You're perfect. I mean, you're perfectly easy.
I'm perfect as a patient or?
No, both. Okay. So as I'm looking at him as he smiles, I can see some of the upper teeth, but I can see the lower teeth. So I know his head is an extension too. Mouth would tell the story. So if I test him from ground up, he's stable here on this foot, but cannot stabilize here. Where does he get the ground? Top down from the mouth. So if I support him on the mouth over here, I can improve things from the other side. So let's just test this. This is just a kinesio testing. I'm basically talking to your nervous system, okay? As I'm putting minor pressure here, try to resist me, okay? Okay? Resist, hold firm, hold firm, hold firm, hold firm, hold firm. Beautiful. And you see how he kind of goes back? Because he gets the ground from his toe, because his foot does not balance the foot. So one more time, hold firm. So as I push down, try to resist here. Okay, hold firm, hold firm, hold firm, hold firm, hold firm. Beautiful, good. Stand on the right foot for me, please.
Side?
Yes, just lift up your left leg. Left leg, there we go. Just lift up your left leg.
Oh, okay.
There we go. Now I'm gonna have you hold, okay? Hold firm, hold firm, hold firm, hold firm. Beautiful. Swallow and left side. Okay, like now hold firm, yeah. Let's see, hold firm. There we go. So I knew that because the vestibular system told me that. Let's see the top down. If he's able to stabilize ascending here, doc, descending is the issue. So you do whatever you do in the foot, then he has a new reference between the foot. He has to organize everything from in between. It's like a phone cord. If your phone cord has all kinds of twists, one end is attached to the phone, one end attached to the headpiece. If you just keep twisting it all the way top to bottom spine, you got to unjack one end, untwist. We can't unjack him from here. The only end we do here. So first phase 1, when I send them to you, I will put a unilateral block on his mouth, which means he's going to get an orthotic in the mouth, which only has few millimeters support on one side molars, which basically stimulate the zygomatic arch with the 3 branches of the trigeminal. Says, there's a cerebellum, go ahead and use this side. Boom, head comes in the middle. It's like I put a jack under a flat tire. Now you can change the tire. Your atlas will not work because every time he swallows, he has to do this. And presses the neck. That's what we do.
It's normal. I do
exactly. Now I knew that. So top down, I know this side is stronger than here. So meaning that, all right, this time I'm going to have you push against me, okay? Push against me, push against me, push against me. Good. That's strong. This side is not because he's got it from here. That's a pattern, all right? Let's go. Push against me. See that? That's a fail. Which one was easier to do?
Yes, this one.
Put your tongue between right side teeth for me like this. There we go. Put your tongue between right side molars. Good. Let's go. All right. Now push against me here. Push against me. Perfect. We fixed it. So now I know this side gets compressed. I'm going to short circuit that here. Keep your tongue in there. There we go. And he loses it. So we're all right on. Swallow.
You fixed the problem.
Yes. Putting a few minutes, now fix it, I get a better reference to the cerebellum so doc can do it. Because if I address that, put your tongue between right side teeth and not address the rest, because I'm a dentist, I don't know any different. You feel better, right? That's what TMJ people do. I decompress them. They walk around with an even mouth with an uneven pelvis. Remember how you were here before? Okay. Hold firm for me. Hold firm. When he walks, he gets more on the toe. The orthotic is gonna, they're like, oh my gosh, I have more pain in my foot. They're not gonna tell me about it, but all the while I caused it. So I'm just running my check, and he's got a pattern. If he doesn't, then I would know. If it has a tail, it's a monkey. If it doesn't, it's a tail. If it's a trauma, there's no pattern. If there's a pattern, when I looked at him, I said, prediction. If there is no pattern, then I would like, doc, can you check temporal bones? I mean, I find them on CT scan. Osteopath gets involved and remove jam, concussions, birth trauma. Like if there's no pattern, they twist and retwist around. Okay, what is the major lesion? We have to line them up. That's where really the whole collaboration comes in. So, yes.
You mean now if we fix something on that?
We put something in the mouth.
Let's say here there was no restorations.
We still can put, so long as there's teeth, we can put the support in there.
We adjust the bite on this.
We don't adjust the bite. Phase one is not about the teeth. Phase one is about adjusting the mandible to the neck so we can rest of the body. Phase one is never about the teeth. No, phase two is not about the teeth. Phase three is align the building. Remember, phase basement, frameworks, then roof, then door frames, and then locks. You're thinking in terms of teeth. The first orthotic is just to level the mandible against the neck, free up the neck, free up the body so that she can organize them underneath, untwist the body. They wear the appliance at night and for about an hour or two during the day as they get chiropractic care. So they align the spine, they align the pelvis, they align the atlas, which is the most important, and free up the structures in the 22 bones here. And then I move them into phase two, which is the orthotic that you see here, the DNA. And the DNA is going to develop the mouth. And now that they have an even body, now I'm going to develop them into that position. Because more often than not, everything else we do in the roof, maxillary expansion, surgical treatments, what we are doing really is basically exacerbating the system because we only address the descending part, but the ascending gets worse. And these guys get frustrated. Believe me, I have chiropractors that are sending me letters and emails and saying, oh my gosh, my patients are doing finally better because I get the mouth to work with the body. But if we don't address the proper phases, phase one, if we start changing, shifting the maxilla, we're going to descend problems. All I need to do is unhinge, separate the maxilla and mandible and support the neck. Phase one dental is support the neck, not the teeth. Remember, when the mandible is hinging off this tube, has no airplane 30,000 feet. I'm basically trying to get the mandible to fly in 30,000 feet to where the foot wants to be. Because these guys cannot do what they do because they're stuck between those 2 points. And when the teeth come together, they're locked. Unlock the system, fix the orientation in 6 dimension. The teeth are exactly where they are. They are. I'm not touching them. The first, in my world, 6 weeks usually with twice a week chiropractic physiotherapy care. Oh my gosh. They come in and they're happy. And in that time, I tell them about tongue rest posture. We address inflammation, talk about running a lot of physiological testing if they have inflammation, dysbiosis, and what have you, because we got to address nutrition too.
So any treatment will start with chiropractor?
Yeah, I work with the chiropractors, and we basically have a...
Any treatment will start with?
No, they address the pelvis and the spine. Again, the chiropractors we trained are very specialized in what they do. Most chiropractors know how to adjust the spine and orient them. So as much as I'm organizing the dentist group, we're doing the same with physiotherapy. You don't, like I said, I'm trying to solve the problems. Right. He's asking they're asking all the right questions. I'm trying to remove the burden of you having to do that because we're trying to train the chiropractors. That's why we're bringing chiropractors into the training as well.
For him, how do we treat step 1, step 2?
So step 1 is he's going to get a unilateral block. The body decides where it goes. But when it comes to closure, it has to shift into rotation to go mate with the maxilla. And that last 25 millimeter causes all the twist to get stuck because let's say your neck says mandible, hang over here. And I can compensate. But maxilla is contorted over here. So the mandible muscles have to pterygoids, temporalis, everything has to just shift the mandible over here, twist all the muscles that are attached to it, the airway, to come over here. So you see how it kind of collapses one side? Now, how do we align the two? Well, if your maxilla is here and your mandible is here, okay, mandible comes to mate over here. This side compresses inside the fossa. The chiropractors can move the fossa. They can align this. That's what has been different for us in dentistry. They told us that the fossa doesn't move. The orthodontists look at a 2-dimension and say, none of this. Sassoon analysis says nothing else moves but the teeth. Lie. I can move the temporal bone. My chiropractors move the temporal bones a centimeter in one session. literally aligning them and aligning the whole system. But when they put their teeth together, they're going to push all the sutures back to the oral position if we don't address the mouth. But phase one is not about the mouth. When you're standing on 2 feet, game changer. You've got to address the ascending, even if it was a descending major. So Doc, I'm going to touch a part of your spine if that's okay. Good. So we know bottom to top, he's compressing this neck because his head is like that. So if I put a support on his mouth, the head comes in the middle, which would put the body where there's avoiding it. So what do? I know that he's got a problem with the sacroiliac joint here. There's an issue between the sacrum and iliac here. Go ahead and drop your hand. So I'm going to test a muscle that does that, guarding this. I'm going to pull this direction and try to resist me. Okay, let's go. Because I pull. So yes, try to keep your hand close to you. Okay, I'm testing the latissimus dorsi. Okay, this is a fail. You see how it's shaking? Because the muscle that holding the side joint up, he's got a short left leg. That's what doctor called it. Short left leg. He's grounded over here like this. So testing the other side to see this is not the problem. Okay, I'm going to pull and you keep your hand closed. Okay, resist me, resist me, resist, resist, resist. You see how it's able to keep up with me? And the whole point of kinesiology test is to not go on yang. We increase our effort together. Okay, let's go. You see the difference? So I'm going to go ahead and hold this together. That's what my sacroiliac or SOT doctors do. We'll put the sacrum into the proper position like I just did. Basically stabilize, tighten up the knots and glues so his pelvis is stable. Now let's go. The muscle would immediately tell me that, yep, I could do this. You see how he's not fighting anymore? Look at this. So if I put my finger here, and this is still an issue, the brain knows, all right, let's go. Keep your hands closed. See how that feels? So that's the problem. If I would treat his mouth, go ahead and put your tongue between the left side teeth, orthodontic TMJ devices, ortho, and not address this, okay? Resist here. Gets worse. He was better off without anything in the mouth because he could compensate. Swallow and put your teeth together, okay? Now hold firm, hold firm, hold firm, hold firm, hold firm. Okay, put your tongue between the right side teeth.
Right side?
Yeah. And he fails. But what if I treat this first or simultaneously? He gets an appliance from me, go see the doctor, 6 weeks later, this is stable. Let's go. This is a simulation, literally. Left side teeth, put your tongue between right side teeth. Okay, let's go. Push against me, push against me. Perfect. This is real life. I'm telling you, we don't know what's happening below that mouth. I didn't either. And the minute I found out, that was a game changer. Now, let's move your head through space, okay? All right, tongue between the, I'm going to just check the neck motion. Go ahead and put your tongue between right side teeth again, okay? And I'm going to test both sides. Good. Push against me. Tongue between the right side teeth, push against me. Beautiful. Tilt your head to the right and keep your tongue where it is. Just tilt it like this. Tilt it. There you go. Perfect. All right, now push against me. Good. Tilt it to the left side. Okay. And he fails. That means when he does move his head as he goes through space, if I only put something in his mouth, only change his teeth, descent, I add to the problem, then he's going to need a new orthotic. Because eventually he has to stack his body against gravity. And the more problem we create, the more twist, he's going to take it to bed. Could I get decompression and get him out of pain? Yeah. Can that turn off some of his muscles? Probably. But is it going to help him with the rest of his? No, it doesn't. Because it's a whole person. The way I have learned to treat the patients working with 3 different flavors of chiropractors, as I say. I work with neurology, structure, SOT, just dura meningeal, the tube that holds us together, structure, and the ones that actually work the atlas alone, because atlas its own, sometimes that's what they need. They're so pathologically subluxed that they might need a powerful adjustment to bring the atlas right in the right position so we can humanly get them to a better place of breathing and getting the flushing around the brain. And then I can just work the 22 bones here to level, because once his head is in the middle, now we have uneven eyes, uneven maxilla. Then I can work up those 22 bones because the base of the support is proper. The first 6 to 8 weeks is focus on the body. But when you have an uneven mouth, you can't do that. We got to break that occlusion, separate the teeth, because every time they bite down, cerebellum is like, I'm going to dial back into that malocclusion, right? Malocclusion is a body malalignment. You're a perfect patient. By the way, easy peasy. Whoever is going, this is perfect. This is a perfect case. Like, I mean, yeah, because
So you mean
No,
that
it's okay.
heart,
You're fixed. Just keep your tongue between right side teeth and you're good to go.
so you mean the heart tissue developed in a wrong way because there was some problems in the breathing since he was a kid.
He's a dysfunction to a breathing, adapting to a new position to
Yes.
continue breathing, correct?
So when you are trying to treat this case, you are treating the body, the fascia.
Correct.
Then
The muscles.
Then you are treating
Fascia, balance of the structure
developed
muscle.
tissue in the teeth. I mean the palate and
No, we don't. We
fascia.
basically, we're stimulating the sutures, all the sutures that are
So
holding the
it's
bones.
like a circle. The mouth is always in the circle.
Always, mouth is the continuation of the body. And when the teeth erupt, they lock the distortions, especially by age 14, they're locked in now. They're locked in, especially if they have a deep bite or they have an underbite or a crossbite. Now their pelvis is impacted. This is truth, guys. Some of you dentists might just go home and can't sleep tonight. Maybe you do, maybe you don't. You know we have two pelvic bones, right? We have one leg here and another leg here. They're independent of each other. And our tailbone is supposed to freely move between the two, not stuck on one side, short like one side here. The iliac, the tailbone, is supposed to move in between, because remember, that's one of the anchors, one of the major anchors of the pump. If it's stuck, the pump is broken. Cannot shoot CSF upwards to clear it. So what do? We clench to move the CSF. Shaq, when I first met him, his driver said he's clenching on the left side. He had a crossbite. He clenches on the bottle caps all day. He's driving me nuts. He broke a couple of teeth over there. He's trying to bypass the lesion, the obstruction, or the concussion. I mean, he's an athlete. Concussion over here. Once we move his sphenoid and level this, clenching stopped. Because the fluid was running without effort. So the two temporal bones here, these two are a reflection of the hip bones. And the mandible is the equivalent of the feet. That's it. That's the truth that we're hidden from dentists. And our face, our occlusion, here we call occlusion, we think it's dental occlusion. Atlas to occiput, occlusion. Ischial seats to the femur, occlusion. Feet on the ground, occlusion. Every vertebra to another, occlusion. So the way we support our head to gaze the horizon, we support our head with the atlanto-occipital joint on one end and with our first molars on the other. Zygomatic arch right here, zygoma, the malar bone, is the only part of our skull that's innervated by all three branches of the trigeminal nerve. So every time first molars come together, all three branches are talking to the sympathetic ganglion, which is sitting right in between palatine and the hamular notch, in the pterygoids. That basically controls the temporal bones, and the whole system comes together when the teeth touch and swallow. That's why I had him swallow, and it would just reset. One swallow. And if we do not address the mouth, it's just a matter of time before the spine collapses, no matter how much we support the bottom up. Unless that's a position they can compromise into, which again, if they can compromise, they have like him, they have a pattern. If not, they're going to continuously, with every trauma we put into the system, would it be in orthodontics? I cannot tell you how many cases of orthodontics come to me. I have 3 patients right now from 3 different parts of the world, young people who say the minute the orthodontics went on, my body started to fall apart. I have not fully seen the case. I just got the case story, and the kid is 21, who was within 3 months of orthodontics, has said, my body, my face, my shape of my skull started changing, my face got sunk in, my jaw got pushed back. I'm suicidal, like the guy is desperate. Because I understand he started with the right side torsion, and what happened is basically the disruption in the nervous system pushed him over the edge. So he was operating budget, day to day, month to month, adaptive capacity wise, nothing to fill his bucket, and one big withdrawal, and he is on. I have a practice full of these patients from all over the world. Now, they don't have to be that bad. The rest of them can compensate. When they can, they will be crawling all over social media and Google and finding me, and all I got to do, like the one I did with the guy who has been doing it for 10 years. And in 3 months, we reversed it. Why is that? Because we were kept from the truth. I know. I mean, every time I do one of these, either I get a lot of blank faces, and then like that light bulb moment, I get people that are just like, that does not match what I know. The dentist part. Can palate expansion work? I'm sure it does get the symptoms relief for some. And if they can adapt to it, God bless them. I know how to put the body back together, and I don't find it. And I know that the system we developed at Vivos is with the mindful set that body can regulate if we abide by the rules of how the nervous system regulates itself. And once we actually understand how the body works, like that puzzle, the big picture is what I'm hoping that I can bring to you guys. Understanding how the nervous system actually structurally, nervous system-wise, chemically, mentally, all of them. Like my assistant just from Colorado sent me a note. She goes, I just read a book that says when we have our emotions stuck in our heart, we're guarding it like this because we can't express it. This is the posture of guarding, which causes you mouth breathe. Because if your chest is tight and you can't extend your diaphragm, now you're an obligatory mouth breather, chest breather, a sympathetic breather, not a mouth. You know what I'm saying? Which one of the problem is it? I don't know.
What I wanted to just take away from this is that all of us have our different specialties. And since I used to, as a chiropractor, be independent in Canada because we really weren't integrated too much with other professions. And here in Doha, I'm in Doc Medical Center, so I'm integrated with the neurosurgeon and the orthopedic surgeons mainly. And so I'm looking at it more from a ground up, which is why I tend to do more of the custom orthotics and the neurosurgeon's my number one referral. However, it takes some protocols. So I have an EOS system. Do you guys use EOS?
I've heard of it, yep. Mm-hmm.
So it basically, EOS is just a full body X-ray, but not as precise as an actual X-ray. It just gives us an idea of how the base alignment goes all the way up to the top. So, and we used to not be able to do that. It was like
I showed a picture of it on the iceberg if you saw.
Yeah, and I have one here I can show you guys, but basically when you put all the pieces together, it does make more sense. So I was just briefly just talking about the fact I do have a structurally short leg, and EOS can help me. It measures the actual bones. And because of that, it's only 0.5 centimeter, and we were discussing this. The ramification is that I have osteopenia in the unloaded hip. And so when you actually put all the systems together, you see what the impact has. Now, I think the really interesting thing and where it comes in is that you can either go from the base up in the clinic that I'm at, or you can go from the top down,
So this
which
is my
I find
question.
very interesting.
You assume that the bone disalignment result with the mouth teeth problem and the breath problem.
Mm-hmm.
But if you want to fix, you start fixing by eventually by the mouth.
Eventually, we have to organize the mouth against the pelvis because I just showed when I put the tongue in between this side, the head goes here, which he loads the spine on the other side. He would avoid otherwise.
But which is the reason?
Well, the reason is because remember I said that he's a neurological short leg.
The bone disalignment, yes.
The body is misaligned. What I'm trying to explain, if there's a sacroiliac joint here that oriented here, so there's a proprioception here that the body tells don't load that. If you step on a toe and there's something stuck in that toe, when your body goes on, it goes, yep, you don't load that, so you offset it, like you come here. You avoid stepping on something that hurts. Now, if I put you over here, 2,000 swallows later, you're gonna have an uneven face too. So, right, so top to bottom or bottom to top. My point is, it becomes a collaboration. What has worked in my hand is first phase, the correlation syntax between chiropractor and dentist physiotherapist is disengage the mouth, position of the mandible, meaning get the occlusion out of it. Because the occlusion, the teeth contact with the eyes, with the vestibular system and neck and the atlanto-occipital joint goes all into the cerebellum, decide what side of the information to rely for three-dimensional orientation. And if one side doesn't match the other, the brain will override one set and it will get you stuck from going there. So roll and yaw, like that airplane, you get stuck in a pitch. We are not allowed to be a three-dimensional human being, which for breathing properly, breathing and respiring, we need to be able to compress and decompress, right? In both sides. So if you're stuck in here, you're not being able to decompress the other side. You're breathing dysfunctionally from this neck to this diaphragm from the chest, not from the proper pelvic. So to organize the body, we got to relieve one set so we can organize the body from top to bottom, like a tube, like a garden hose. You have to twist it for the same direction at the same time. I hold the fort, like I said, that's why I showed the car. 2 front tires, mouth, 2 back tires, the feet. You have a flat tire over there. Basically, the car is landing on. I put the jack on there. So she changed the tires. We have a level system without the interference of the teeth that are in malocclusion. When I had him smile, one side of the maxilla is down. Every time he bites down, he's going to re-exacerbate this because you can't swallow that way. Swallow is the one thing the brain goes, check everything is level. That's why we swallow. So what happens is the maxilla is not, and the brain goes, okay, I know what to do. Employ the sternocleidomastoid here in temporalis. Okay, temporally, everybody guard. So when I test this muscle, and this muscle are tight.
So nothing is called centric relation.
Is what?
Central gradation is.
No, I mean, those are really terms that we just so hang on but dear life as if the
Because it's all.
It's all the two.
All the muscles are like
Exactly.
one piece.
all the muscles are guarding. There's not a single motion you produce with just one dimension with one muscle. There's not one single isolated movement from any muscle. They're all, brain is incorporating this muscle and that one and this one for this compensation. The brain at the end of the day gets sensory information from your foot, from your ischial seats, from your ears, from your eyes, the way you put your teeth together, and it goes, let's see how I can orient you. I'm going to employ this muscle with that one, with this one, coordinate them. That's a relative flexibility so that I can survive. It's not living, it's surviving. And you can do so against gravity till your joints start to give, until your ligaments start to turn apart, and you have a locked TMJ, you have a frozen shoulder, and you go see whomever.
Last of the way, and the end point is the dentist.
Well, the end point is a dead
Because
dentist.
If you fix
Yes.
the soft tissue,
Yeah.
then you will, the final...
Doc, can I tell you something? The question you asked is going to require 3-day training, and that's brilliant. But if I start answering that, we're going to have to sleep right here tonight.
Can I ask the $1 million?
Here it is. I know, I'm like, I love you, but I'm jet lagged.
I think the $1 million question.
$1 million question.
Everybody's mind right now is, number one, you've already convinced us. This is very.
Are you guys convinced? Who else is convincing?
I'm convinced that you're onto something. But what we want to know is how can we
Yes.
integrate this
Yeah.
in? Because
This
I think
problem-
that's where the puzzle's
But
coming
so
in.
using
Yeah.
this
There's a
removable
very
appearance.
I want to.
Using this removable appearance.
Yes.
It will reflect with the skeletal results.
Yes. Yes. Yes.
Even for adults.
You saw the faces, right? Yeah, that's a skeleton. Doc, I'm not. I'm not. I know. This is.
You know,
Because I need to
you,
understand your
sorry about. I see the faces, but the skeletal
The
results. Sorry, skeletal results. You cannot judge by faces. You have X-ray. You should have.
I have the X-rays too.
You should.
Okay, you know what's so funny?
We didn't, so
This is what I was saying. Like when I see the distortions, I actually have a slide
if
that I have like a nail in the forehead. You remember the nail in the
If
forehead?
you want to judge the skeletal results, you should see the X-ray,
Okay.
not the faces.
Okay, you know, I love you and I
Result?
love your orthodontic brain, but I will break you.
Oh my God.
Oh, I will break you. You got that on camera? I will have a moment where I have you in a headlock saying uncle. Because I'm telling you, you want to see my daughter's X-ray? Since you asked, I have them. It's just that I have an hour
But
here.
your daughter
Would you like to?
was a child.
Doesn't matter. I have an adult. I can show you the adults too. Like I said, in 1 hour, Josh's case, right? So like I said, I have all the results you want to ask. But you know what I focus on? Because what we want, we are fact finders as dentists. We are fact finders. If you have this equal that, the Newtonian tells us, right? I mean,
ما فيك بدك تحكم على هارد تيشو
هارد تيشو طلع
You cannot judge هي لا لا.
اوكي
This is opacity. This is opacity. This is opacity. Yes or no?
okay.
You cannot judge with this one.
What?
You should see X-ray. Sorry.
And what does X-ray add to you? She's living a happy life. She can breathe. Her nervous system come online. She can sleep. Why would you like to see it? I mean, I can show you X-ray. I mean, there's a nail in her forehead. I can show you there's a nail.
I respect.
Yeah.
I would.
No, that's it. Like I said, you're an orthodontist, honey. I know in a year from now, you know, it's okay. Here's the thing. What you know is head knowledge. And that head knowledge is that bias is like, I got to see it because that's what you were trained. That's your training. And trust me, I had that too. It's not in your heart. And, you know, to get from your heart to here, there's a disconnect before you can put it in your hands. I don't need you to take my word for it. I'll send you guys a documentary to watch. You know what I'm saying?
Yes.
Right.
So tell us, I think, because you're losing some people, because we're all interested. Tell us how it works now. So
Yeah, the
how-
way that
how
works.
we-
So because I'm really into just making sure the body works top to bottom, bottom to top. I had to syntax the work between the professionals that help the dentist. And the phase one for me always is, where does the tongue and the mandible want to hang out?
It's very important.
And that needs to be addressed before we engage with changing the cranium and the maxilla. Because once we change the roof, the body has to reorganize itself underneath. The first phase does not include changing the maxilla, palate, or the teeth, especially the teeth. What I do is adding a lower appliance with just a block to what is sufficing to where the neurology clears for the neck, to bilaterally have the ability to move. And at phase 1, they get the appliance. They're not going to wear it during the day until they get the clearance from the chiropractor. So the chiropractor, I work with very particular techniques called SOT, sacral and occiput. So basically they align the tube, the neural tube, from the tailbone to the occiput so that they remove any obstruction in between so that the tailbone can freely move. So if you have a short left leg, that means your orientation is here. So bring in the tailbone so it can move in between the two ilia is the phase 1. And that usually takes, and those are the courses that we are trying to teach the chiropractors here that are open-minded to learn, so they can employ those techniques with the SOT, with the blocks. And when the patient is using the breathing exercises, they get a stable pelvis. And then the position of the foot changes, so we have to rewire the cerebellum to the foot. So if you have a short left leg, you have no sensation there.
I hope you learned something new in this video. So patient's posture from the top to bottom in a static position will tell me everything about the state of their spine, the state of their tongue at the roof of the mouth, and more importantly, if they can use their nose to breathe through the diaphragm. To heal the body, we have to address the nervous system. And the pulse to the nervous system is how you breathe. To breathe nasally, we need more than just closing our mouth and getting the tongue to the roof of the mouth. Because if body's posture, alignment from the toes, the diaphragm, the pelvic floor, orientation of our head to the neck, the jaws, and all of that is not addressed, we cannot just close the mouth and say that we can breathe through the nose. One of the other important aspects of breathing is the chemistry of the brain. Basically, the gas exchange and the pH around the brain for extrapolating the oxygen, which is the most important thing we need. The movement of the spinal fluid around the brain is totally and 100% connected to the way our diaphragm works, the way we breathe, the rate we breathe, and most importantly, how the structures are connected together to make that happen. So evaluating the static posture, the facial features, and the orientation of the head to the neck to the pelvis is everything I need to know to be able to evaluate the patient and diagnose their apnea. I hope this helps.